Welcome back to Growth and Development. We're going to start talking about biologic development. And actually, if you look in the beginning of each chapter, you will see promoting optimum growth and development. And it does start off with biologic development. And as far as the infant goes, there are they go through very dramatic changes during infancy. All the body systems undergo a very progressive maturation. They all grow in a cephalocaudal manner, so meaning they grow from head to toe and center to periphery. Looking at the toddler, weight gain tends to slow down. Typically they gain about 4 to 6 pounds a year. Birth weight should be quadrupled by the time they are age 2.5. Height will increase, and growth is step-like rather than linear. As for the preschool age child, it continues to slow down, and actually across the spectrum, infancy and adolescence is going to be the two areas where the child goes through the most profound amount of growth and development. During the preschool age, their height does continue to increase a couple of inches every year, and again their body systems continue to mature and stabilize. Typically during the preschool age time, that is when we see their immune system kind of becoming almost adult-like, and so they continue to go through major changes. And then with the school age, again, we're going to see an increase in height and weight, and males and females do differ a little bit in size, so we don't really see that bulking up of the men and the maturing of the female like we will see maybe toward later school age and into the adolescent time. During the adolescent time, that's when they're going to develop their primary sexual characteristics. So the external and internal organs are going to begin maturing. This is typically the time between a late childhood and early adolescence when females will begin their menses. We see hair growth starting to occur, breast enlargement. We see the fatty deposits on females changing differently as we do for males. So typically during adolescence is when we're going to see the most outward signs that the child is maturing. With physical growth, that is going to be a dramatic increase in growth. Typically the adolescent growth spurt is, like I said, very large, and they typically achieve 20 to 25% of their total height during puberty. So they definitely begin to grow taller. Sometimes you notice that kids appear to be sort of long and lanky. When you think about adolescence, just remember it means to grow into maturity. It's generally regarded as a psychological, social, and maturational process, and typically these begin to occur due to the changes that are initiated by puberty. With hormonal changes, the events of puberty are caused by the hormonal influences, and those hormonal influences are controlled by the anterior pituitary gland, and the anterior pituitary begins to increase those hormones due to stimulation from the hypothalamus. This is where we see the secretion of sex-appropriate hormones, so with estrogen and progesterone both from the ovaries so that the female ovulates, and then testosterone from the testes for the males. And this is all on page 1106 of your maternal child health book. With the sex hormones, they tend to cause feminizing or masculinization. Typically, the feminizing hormones, they're obviously low in production during childhood. Males, they have a gradual production throughout their maturation, and females typically increase until about 3 years after their menarche, and then after that females will remain at this maximum level throughout their reproductive life. And so then once those start to decline, that's when that female is going to go into menopause and then become postmenopausal. With the male hormones, those are known as the androgen hormones or masculizing hormones. Those will be secreted in small amounts and then gradually increase until that male is between 7 and 9 years, and then we see a rapid increase until the male is 15 years old. And so that's why we see men or young boys getting really tall and lanky. They have really long arms, long legs, and that's in response to how fast those hormone levels are changing. And then males will increase to maximum level at maturity, as I said before. So when you think about sexual maturation, there's Tanner stages of sexual maturity, and these are just the stages of development of secondary sexual characteristics and genital development. With our girls, we tend to see the appearance of breast buds between 9 and 13 and a half years, and then the growth of pubic hair typically is a couple of months, 2 to 6 months after those breast buds start to appear. Typically, I think your book talks about the average age being like 12 years, 9.5 months to be so specific. With men, or with boys, we see those first pubescent changes occurring with testicular enlargement. The skin becomes a little thinner, and there's looseness of the scrotum. That we will see penile enlargement, pubic hair growth as well. Some boys will go through a period of gynomastia, or breast enlargement and tenderness, but typically that will disappear within about 2 years. So just take a look through this stuff in your book. These pictures that are located across the bottom of your screen are also located in your book. Sex differences, in general, growth patterns. Typically, they are a result of hormones and how hormone affects the puberty. The earlier cessation of growth in girls is caused by the epiphyseal unity, which is the ends of the bones, and that's due to the effects of estrogen secretion. And so as you can, if you think about that and you put that together, women have an increased risk for osteoporosis as we age, and that's because of the strong effects of estrogen. And then we know that as we age, then we go through menopause, and then we have the decreased secretion of estrogen, and so that will put us at increased risk for osteoporosis. So you need to kind of, associate those hormones across the spectrum, specifically here in the adolescent and child areas. But then when we start talking about the older adult later on, then you'll be able to kind of put 2 and 2 together. We talked about boys having a longer growth period than girls because their testosterone levels continue to rise. Other skeletal differences are increased shoulder width in boys and then broader hip development in girls. With pediatric obesity, we are seeing an increased prevalence in the United States. And the thing to think about with obesity is obesity can change the timing of puberty. So girls with thelarche, or the first signs of breast buds and getting breasts, will have greater body fat, that have a greater body fat and body mass index will tend to have their menarche a little bit sooner than those girls that don't. We don't really see a relationship with boys in the effects of obesity, but we do definitely see an effect with our girls. As far as psychologic changes, during the adolescent time, the physical changes of puberty are primarily the result of the hormonal activity. The primary sex characteristics are going to be the external and internal organs that carry out reproductive functions. Secondary sex characteristics are changes that occur throughout the body due to hormonal changes, so voice alterations, developing facial hair, those types of things. With the hormonal changes, that helps the rest of the body with the capabilities to increase in size and strength. So we do see an increased level of cardiac, respiratory, and metabolic functioning, and all of that is related to the hormones, because as the person themselves mature, their body must also mature. So now we need to step back to fine motor development, and we're going to look at the infant. Fine motor development behavior includes the use of their hands and their fingers, and we note that grasping occurs during the first 2 to 3 months and then will become voluntary as that infant grows. Infants demonstrate a desire to grasp an object early, but really when they're grasping it, they really can't pick it up with their hands. It's more their eyes want to be like, ooh, I want to pick that up, I want to pick that up. But typically the infant uses a crude pincer grasp by about 8 to 9 months of age, and then progresses with a nicer, neater, more mature grasp by 11 months. They build a tower of 2 blocks around 12 months old, and if you look on figure 36-1, that's the picture of the little one that you see on your book. This information can all be found in chapter 36, looking at the infant development. With gross motor development, we know that when infants are born, typically the full-term newborn can hold their head momentarily, but infants do not have full head control, and typically run the risk of suffocation in the prone position early in infancy because they're not able to lift their head out of a depressed object. So if they were on a lying on a pillow or lying on a bed, those kinds of things. Around 6 months we should see that head leg getting better, and then by about 5 months of age they should be able to turn from their abdomen to their back, and then from their back to their abdomen. That's about a month later. As you can see in this picture, the infant does gain greater control of their muscles as they age. By 7 months, infants can typically sit alone. Sometimes they'll lean forward on their hands for support. By 10 months, they should be able to maneuver from a prone position into a sitting position. So we will see that cephalocaudal growth growing from the inner to the outer. And then this is just a picture kind of addressing what I talked about and how the infant tends to grow. And continuing on with gross motor development, we talked about crawling by the age of 6 to 7 months, creeping 9 months, and then walking with some assistance around 11 months. And then typically we see our kids walking alone by around 12 months of age. As the gross and fine motor development continue to progress, we should see better coordination between the ages of 2 and 3 years old. However, we do see lots of falls and stuff, and that's kind of typically due to their potbelly natured. They sort of have a round midsection, and so trying to balance that body with that tummy like that does cause a little bit of poor coordination. With their manual dexterity, we should see them being able to pick things up with their fingers, throwing balls by the age of 18 months. As they progress into that preschool stage, we'll see them walking and running, climbing, jumping. Those things by the preschool age should be very well established. We should see them drawing, getting much better at skillful manipulation. They should have better eye-hand coordination, muscle coordinations as they get older. In this picture, it demonstrates what we talked about a couple of slides ago, seeing that as our infant ages, you can kind of see that this infant might be a little bit younger than the infant in these pictures. And so as they continue to develop and continue to age, we will see better coordination and movement. I'm going to end now, and on the next presentation we'll talk about Erikson and Piaget's development, psychosocial as well as cognitive.